My better for the half hope you all man fine, hope you all man woke up fine. So today another episode for Beta Torpoh, and today for Beta Torpoh the host Dr Ebasone Vanes. Now some medical doctor, young medical doctor, going to tell you plenty about coronavirus, about sick day for Cameroon, and about how we feel, take care of our health and for be better person so that we go live long. So our picking they go enjoy with it. So we're gonna stay tuned, and when we come back, we'll continue longer on a Beta Torpoh with Dr. Vanes. So my Beta Torpoh, just as I tell you today we'll be longer on a Beta Torpoh with Dr. Ebasone Vanes. Vanes, how far?
Fine.
How are you? If you ever find or see young doctor, how do you feel a young doctor?
I don't know how you look at it. I just feel normal.
Get into Chelsea Hospital. Tell me, get. All right, so we'll take a short break and then we'll come back. We'll continue longer on a Beta Torpoh with Dr. Vanes. Alright, so when stay with the first way, when me I go personally like for no. Now how it be day for go for medical school for Cameroon? Like I know you study for UB, you do 7 years, now 7 years now, like 6 years and then 1 year practical and I say
7 years.
7 years. Okay, so tell me how you do for stay for school for 7 years.
Okay. Before I start talk, I'll first like to appreciate you for what you don't do, and because I actually be able to see better things sometime when we start.
Yes.
And for me personally, I look where you don't reach so far. Yeah. It be remarkable because for internet-based businesses in Cameroon, it be very difficult for most people. Yeah. And for me, I check so being a good model, particularly people they watch, they aspire for doing them, for really try to understand how what you do. Because apart from the skill, right? So other factor na perseverance and passion, and I check saying that the biggest leverage that we get on so far for be able to reach for this point. So great. So okay, so back to your question. At medical school, really from person where they outside, it look very long. Yes. But for we all go through. When you day inside and say already take that duration, you feel them. I know be noticed that I don't the 4th year, then very soon 6th year, 7th year, and it's done. And then the school never stop. And you still get for good specialization and sometimes sub-specialization. So and I think say now why that people where they don't do medicine before, they get the extraordinary ability for school for a very long time for their life. Yeah.
That's true. So like what inspire you for be doctor? Like what's be a passion?
Okay. No, come on. I actually love medicine. I really love medicine. But I think people they miss the point when they talk about passion, because if you think about passion as something they born you with them, in reality it not be so. How do you know you are not passionate about football if you have never tried to play football? You see, I know. Yeah. So you must passion really whether you love to do the thing. I don't know whether the whole idea of passion is until they appear for your head, whether I come outside. But personally, I be very passionate about medicine, and unlike many other professions, medicine be more like vocation. And at the same way we formed for school, for look medicine like you did compared to what people do to communities. You understand, something close, not exactly the same, but something close to that. Yeah.
Okay. All right. So after the specialization, like people they believe for Cameroon especially, like that way you start do medicine, for example. Some plenty people they still check say no, they get for travel, maybe go to Nigeria or travel go out for go. So, but from your experience, like what you the advice person we want to be medical doctor for Cameroon? Because people they still believe say if I want to do medicine, better I might find money, travel. They don't believe say they fit do for Cameroon and then really come out be the doctors the way they're supposed to be.
No, I get to be clear. Medical training for Cameroon be of very good standard. People they train for Cameroon, they do well elsewhere, get plenty, get senior colleagues they practice medicine now for America, for UK. After they come out here, they write board exams them for their respective country. They practice medicine for there. So that one a fact.
Yeah.
Cameroon, we do well in terms of training. You know, do it best. So far we could do better, but we are really not doing bad. You understand? And then another fact I say, in terms of education for Cameroon, medicine are the most practical thing. Why it be the most practical thing? Actually, because the teacher way they teach you. Now, often professors of medicine, they see patients in the hospital, then they teach you for class. So no other field get that level of experts there.
Not true.
You understand? And secondly, the practical element, patient they everywhere for Cameroon. I mean, on every single hospital. I mean, patient they outside. I mean, the practical element where the student need for go through that formation. And I bet you say for Africa, it even be be more possible for you for see more patients, learn more than maybe in other countries. To be honest, yeah.
Wow. Wow. Okay, so you know, like, wait to be at that way you be going inside, you do medicine, you get expectations. They must show. So okay, when you come out the field, na so good day, you know, wait to be. I mean, expectations versus reality for you.
Actually,
wait to make I come out that it shock you. That I not be nothing. I say go big when I finish school.
I don't really talk say shock because
if you don't know,
a lengthy process. So na kind of transition, like you go from you only sit here, you don't start. Get a better glimpse of how things look like. You see, I know. So I just check say the expectation. I say more and more people be trained, and it means say it become more competitive, which is good for the patients. You know, like people who are better doctors now have to survive. Those who are not able to work on their skills better might not survive as much as those who are there. So it's good for the patient. More and more people are trained. But I just check say, in my opinion, government need to do a lot from the angle of incentivizing doctors. I mean, countries like Cote d'Ivoire, they don't incentivize, like improve working conditions and all of that. I mean, so on statistic day, I don't know exactly where it came, but I came across a statistic that says that about half of doctors trained in Cameroon have left Cameroon to work elsewhere.
Wow.
Yeah, that's huge, and that's an indicator that something needs to be done in that area.
Okay, all right. So until we like 2020 come, all we enter shock with coronavirus. Like the year starts, we get our plans them around March. We start coronavirus. Oh, we check out. Yes, something for China. The work for China. I will make that China no those no concern with. After we can start the years, okay, let's go Italy, they Spain, they America, they after 1 year, enter Cameroon. Before we enter Cameroon, we feel we're free. You know, we not say nothing for Africa because we're like Master, now why put they sick, you know, and then they take Canada for Cameroon now. They start to tell us, okay, you have to come on wear face masks. Oh, no, come after the time, you know. Some people they talk in a lie, some they talk in a true. They start to say, oh, some people they don't die, you know. I mean, like tell me about coronavirus for Cameroon. Now, true say coronavirus actually the Cameroon because we never ever see coronavirus patient, never ever really know. So some people would they actually check say this thing so he actually really come or he no come or why we're only na so why you know they that put their own way we say thousands of people they die, you know.
I check say this skepticism it be real and it exists, and I check say the skepticism now because in our generation, like in our own lifespan, this maybe from the 50s to now the first real pandemic after HIV, we really hit we will not most people their views they not be really see how high cancer. Yeah, so this kind of thing never ever happened before. I mean, influenza. You know, get polio, you get cholera. They don't happen before, not be the first time. And they always get started in some place, and then it is spread. People they carry on, they go different places. Then, so just to be honest and factual, to state it clearly, coronavirus be real, and coronavirus is Cameroon. And the skepticism too, I check say be quite alarmed by internet. I mean, people be. People they on the contrarian, on the opposite side, they be skeptical. But again, society. Society.
Points the way they bring them up.
Exactly. No, we not feel silent skeptics. It be very important. I mean, skeptics they make and you say with question your own self. But na fact because imagine say for build a hoax of that level, you need to convince people for plenty countries there. it's even impossible to build that as a hoax. Go convince people for even country in an enemy country like China, USA, they battle, or Russia, but all of them they agree. Say coronavirus day, and scientists in the respective country they get the same view. I mean, no be like say some person work a bribe scientists for she don't quiet, the one for she don't quiet. You understand now? And I check say people need to appreciate that fact. Then they will understand say the thing be real. If it affect black people, because a lot of debate don't be around this. If it affect black people, if it die of the thing for Cameroon, but at least we have to be grateful to God for the fact say most young people then they not fit die. I mean, majority of people where they get coronavirus, they even get well without even knowing, or maybe have mild symptoms. So not really good thing, because I mean, if they think they be as fatal as other sick, they really broke person down, then maybe half our population they already go down.
Okay, but now for Cameroon, for example, it's kind of say the virus I don't know whether that's the strain of the virus maybe for America and China, all the country them it be different from the strain of the virus maybe for Cameroon, because
no evidence no day for toxic new strain day Cameroon. So the strain we there for here now definitely the coronavirus will come out elsewhere, and we all man observe how coronavirus work. I mean, we know how it enter for airport for Yaoundé and Douala. I mean, we follow they like movie, we always see them in real time. So nothing superficial. I mean, like coronavirus be real for point where sometimes I even wonder why person will dispute them. But then maybe I look from the internal side, like being inside medicine, and then I'm not understanding how other people are seeing it from outside.
All right, so we'll take some short break, and then we'll come back. We'll continue to discuss about coronavirus. Okay, but the thing where they shock you the most now say the way because now I ask whether the strain ready for that side and the strain ready for itself, because say of the way they kill people on the other side and the way it kill people. So recently, our Minister of Health talk say WHO don't congratulate Cameroon and Zambia, saying that the two countries that don't handle coronavirus the best. So what would they do for Cameroon, or what would do for Cameroon where they make in any affect me like that, or as you mentioned, so plenty people they don't get them, but they know die. Now waiting up because the two the chop. Now what would they do?
Actually, now. I've discussed this with several professors there, and actually been one very interesting research question, because all man would expect say the epidemic will hit Africa in general, or sub-Saharan Africa, like it hit Europe. I mean, Europe don't suffer, but several reasons in the way they explain, not like absolute answers, but several reasons in the first I say population for Africa be relatively younger. I mean, more than 50% of Africa they below 18 years. Yes, and we know clearly say coronavirus mostly affect aged people. They will get these cardiovascular diseases, cardiometabolic diseases, and all that. And now the first point that. Secondly, most of Africa don't suffer more from infectious diseases. So health system inside Africa they be really used to managing infectious diseases from HIV, malaria, polio, all of those kind of
infectious disease that see way be transferred from one person to another.
Yes. So be more of a disease. And why I even focus for our health system for yes, I be really been at the moment more oriented towards infectious diseases. So we really get quite a wealth of expertise in that area. So now one positive point. Then other hypotheses them. Now say people they way they hypothesize say BCG vaccine. It be protective for
BCG vaccine.
Now the vaccine they ever give small picking them. I mean all man get that mark for year. Yes. No, BCG. BCG now. BCG now for protect against tuberculosis.
Yes,
yeah. So so they saw some suggestion they say it be protective. You understand now? Then now why that talks in a very interesting research question for understand deeply why we say the pandemic no hit Africa as all man be suggest, but but that's really amazing. Maybe God the look down.
So and then what about the chop the way you put like garlic, ginger, all that in them, like people they like how they think all man be drink and fever grass, artemisia.
I check say I know if it talks in the work, the first thing, because where we evidence the work for medicine and healthcare, and I say you get for established evidence, like find either say when you give the thing for the thing will kill this, maybe this microorganism or this or that, or solve this problem. That relationship no be strong and no be well established. You understand? No, for way if you been a fact way if you recommend that, and why I know see I'm like very open recommendation. Generally, people they take now assumptions them from other viral infections them and from other diseases, and they try for bring that same application to smart thing. They will not say very big differences in there. You understand? They like, for example, for check say people the way they believe say the normal flu, kata like influenza. Say if you treat a coronavirus the same way because all are flu, but then they get very remarkable differences there. You understand? No.
All right. So you now, as medical doctor, like since when it is that you don't get any personal experience with coronavirus patients?
Yes, of course, yes, of course. I mean, it be real, and I understand why people they be skeptical. The test where they use that to do coronavirus. You want to say they just invent them for just create people fear. But why? What to be the objective for big people fear?
Plenty reason they didn't know. Like so that some people they benefit from the after at the end of the day they'll make vaccine, and some people they go sell the vaccine and they go and make money. It's just like hard for them to create. Some people they will work business on social media, internet for them to create virus. Then they create antivirus and sell out. So kind of thing. So some people will look at.
An actually reasonable perspective that, but at the same time, all this idea of big pharma controlling business and all, you get limits, you understand now, because we need to understand, say, two elements that they in play for here. You get science, and then you get business. Businessman, your objective now for maximize profit. Scientists, often good scientists, them truth seeker them. And you need to understand, say, scientists they be distributed worldwide. No man know the control all scientists. I mean, we get enough scientists, very good scientists there. Cameroon, we get them for South Africa, even Madagascar too. We get own scientists there. China, even North Korea, of course. So other scientists they work on the thing, and it been a consensus like agreement. Coronavirus be real. The test. You know, if you make tests where it be fake, you send them away, they get their own scientists, they know how they validate tests, they accept tests. You understand the level where you need to go before a full all man for play in that game where they consider.
So scientists they talk say they test the way they bring up, say they test on top cocky, so Cameroonian doctor talk say test on top cocky come up positive. He test for Torpoh test positive. So the other thing, just calculate say so then even they don't carry take we play.
Actually, no, and I totally understand because. Imagine for every piece of thing where they try to understand them, right? You get some big knowledge gap, and no man knows, even the most experienced expert, get like 100% knowledge. It get to an extent, a spectrum of that, like maybe 60%, 70%, if at all, if you define them. And then some person did like 1% or nothing, You understand, no? And for you to really be able to make a good judgment, argument, you need to get substantial knowledge. And the problem that people try to narrow in using common sense to answer really big questions. Like, if you get like peanut size understanding of some topic, but they try to give expert level opinion on something. You understand? No? And even me, I get that kind of perspective on things and like microeconomics, so that I'll be very interested in those kind of things. But I get my limits to understand when I'm a checking it for fair before I make even like public statement. Like we see that a lot. If you go YouTube, you get like millions of videos, and they buy the idea because they speak in a language where layman they understand. Like men, they agree. You understand, no?
All right. So okay, now more come on coronavirus. So coronavirus won't come for Cameroon. Very about plenty things they worry for Cameroon. As you mentioned HIV, you mentioned I mean, we for Cameroon especially, what's like what attitude towards healthcare, like the way they take care of our skin them. Some people they never ever go hospital. So what they do last they go hospital, they be small because their mommy they be take them go hospital. But since they can't big, they never ever go hospital. If person get headache, you just calculate okay, so target. If you start sweat, my joints are hot, okay, now malaria, I just go buy malaria medicine, catch them if I was drink them. If I play, you never go hospital. So what's if you advise use them on their attitude towards all the healthcare and taking care of themselves like medically.
Yeah, I check the point where they raise some don't really go through my mind a lot because me and you don't first do some health education stuff on Twitter, right? And And people like for things in a deficiency of information. But I think the internet don't democratize knowledge for where all man the talkie own for any side. So no man if really claim ignorance to an extent. Where to be difficult and behavioral psychology that we confirm. Now for people to change their attitude, it be extremely difficult. Behavior. Now health, I check in at the focus. The conversation give to be around helping people build good health habits and behavior the way they be positive for healthcare. You understand now? And I was talking to some person the other day, and maybe around the subject of HIV, and maybe this get the kind wata kind of perspective, you know, like ibat, you know, and I catch I don't think go do test. Why if I go know now when it come, you understand? But and that way for see not just about HIV. If he be too the same apply to other diseases them. You understand now? So I check say if people need to understand say health now the most important thing we get them. Now the biggest asset we get them as a human being. It'd be funny say people really sabi place health not at the top of their priorities. You understand? No, you ever put them for down, maybe put other things them for front. If really look at really the most important thing for you, if you die, every other thing stops. Or maybe your life be shorter, you know, if you accomplish maybe your dreams, your passion, your ambition. If you marry, and for young people, most people marry, you get to make sure you optimize your life so that if you take care of your children for a longer time. If you marry, then maybe you start dying in your early 30s or 40s. I mean, you put your family at danger. You understand? I think if people not be selfish, and if you think about other people there and how your own health affect other people, maybe those kind of attitudes if it change, make you change you, and help you for understand say be important, especially from a preventive perspective. People know what preventive measures are the most effective way for solve problems for healthcare. If people use preventive measures for avoid HIV, do things like exercise, will be incredibly important. People make sure say they get health-seeking behavior. Like if you is sick, you go to hospital. Go to hospital, they're cheap. You might get other problems like waiting times and the rest, but healthcare really be cheap for Cameroon compared to many places in the world. I mean, you might sacrifice a few hours, but it's really worth it. You understand now? So I would really encourage everyone to take it very, very seriously.
Okay, which way if you advise people them like concerning their attitude towards healthcare? For example, if you advise us, okay, maybe go hospital, maybe I don't know, go do checkup, for example, once a year, or you know, like which kind? What do people feel do? Like if person hear you now, I need to check. Say, okay, I don't neglect my health. What I need for do now for pick up? Did like change my fashion? Now which kind of thing I need for stop? I'm like. Especially concerning habits them. For Cameroon, we drink beer over, we not believe in sports like that, you know, smoking, shisha, like, I mean, which kind of advice if you give?
It can be tough the first time. Most people they know where to be wrong. I mean, even people they do for audience here, they know they don't go through from primary school, they get a good understanding, at least substantial information for static action. Now, for really understand, say, that action, they start now, you know, they postpone now. You know, you talk, say, maybe not from tomorrow, or not from next week, or not that, or you understand, for start, for play with it. Maybe just start small. Start small. If you, for example, if you try to improve in terms of, let me say exercise, just 1% improvement every day. After 1 year, exponentially, you don't do like 37% improvement. It'd be remarkable. Just by making little steps. You don't need for Joe come out today, Joe go Pakuvita, then Joe run like 20 times around Pakuvita. You know, no, maybe start walk around street, take a walk, try to attain maybe 10,000 steps a day, and from there step it up, take the next step, and in that way you really find some true passion in the whole thing. And that's just for exercise. You can apply that kind of mindset to diet. To things like sexual health, be conscious. So you need to take that action. And when you take that action, you really look at 1 year later, it's like how much you don't
Progress.
improve. Already enough motivation for you to
Continue.
take through life with that kind of
Attitude.
Yeah, with that kind of attitude. Yeah.
All right. Okay. So we'll take some short break and then we'll come back. We'll continue longer on the Beta Torpoh with James. Okay, so there's one interesting thing I would like to know from you. Say for the time we don't work for hospital, now tell me about like the worst experience we don't get time for inside field.
I check say personally away from see person dying, agonizing die and all of that. So, yeah, away from that, something I'll be really interested in people their ability for access healthcare. And one of my experiences there been some probably sick and then been actually for more like rural setting. So so they be admitted and one night for hospital in terms of hospital bed been at 150 francs. I mean it be that cheap. And then patients spend like 6 days and then discharge patient. And then the mommy can corner me for back say, doctor, you get farm where I feel work. I'm like, you don't get money for pay, you understand?
And I mean, 150, so
150, no, you bill totally be 7,200. So you know, fit pay 7,200 francs. It be actually pick cover a bed. The team be worrying me personally, and it means they also get a very long way for go for the health system for Cameroon. And if we were there, for example, for towns, if you really check say Cameroon, now how your experience is about town, this is you already live na a task life for Douala, for example. Man way they maybe from village of Furawa or for Fumte or for some place or inside Bafude. You get totally different reality, and that reality na misery. Abject poverty, and now that people I check say health system they need to really try for first address that one. I mean, we talk about health behavior, so man get money first. You know get na the will or the zeal for go hospital. What a person way he want to even go hospital, but you know if he even go. So for me, it be very saddening for really see and say we still live in that kind times where person not be able for even it be willing but it not be able for go for afford.
Really be sad. Then tell me about your best experience so far.
Personally, I know people point to one case, but generally I like when patient care about the health. Like you really see you talk say come in this number of the patient come, go do this, do that. It can be see I be enthusiastic. It really there's like some partnership. It's interesting. Now for me, always been a repeated experience, especially some older people they get chronic diseases like high blood pressure. And they take it extremely serious, and we get a lot for learn from our parents and where they get that kind of sick them a lot.
Wow. And then according to your experience, it's like the common disease you don't personally encounter in hospital, like the common sick with Cameroonian.
The commonest sick they still remain the same way. No malaria, typhoid, dysentery, of course HIV too. I mean, prevalence for HIV be real. HIV, there are about 540,000 people living with HIV in Cameroon. I mean, that's huge. Meaning say somehow maybe between 1 in 20 to 25 people will meet up for Cameroon probably get the disease. I mean, if you even just imagine them in that way, maybe if you make you start here and take the necessary action. It be real, very, very real. And I be particularly we'll do some studies there and some program there on HIV, and we'll really see. I mean, nobody say the data there, we'll get the data, and it look nice. In Cameroon, get one of the highest HIV prevalence level for Central African region.
Imagine.
Yeah, so it really be serious.
Why you check say high so like what people they do? People they need to use condoms. People they neglect like people they be promiscuous. They are not faithful to their partners. Now wait see.
I check say the reason why HIV know the end as fast as the people end. And people don't know their status. So now people where they don't know their status, they share because man way know his status, they put you on treatment. Usually they attempt to call and say viral suppression. And in the first 3 to 6 months, most people they will attain viral suppression. And when you be virally suppressed, You know if it transmit HIV, means a person will get HIV.
Wow.
It take infection very, medication very well. It attain viral suppression. You know if it transmit. Listen, na man we no know his status. Where the worker get confidence, say no get them. You see, I know. Yes. Now for the way the problem, they now why they ever insist. Test. If you test people, you identify them, place them on treatment, we solve the whole thing. Then now we know say the manage now, the one the way they get them.
Wow. Dr. Vanes, don't teach me plenty in them. So you know if you can't go, so we get some small gifts for you.
Okay. Thank you very much.
You're welcome. And then so last thing I want to know from you, like say, okay, as medical doctor, young Cameroonian, like where to be where to be a pineapple, like your personal pineapple when you should have house or when you want to motivate yourself, you talk out.
Okay, personally, I mean my friend they will not say I like to talk about stuff like this. So personally I believe say if people look at, for example, achieving in whatever domain, like I talked earlier, say, I really admire the way you don't push through. If people imagine, say, they get for succeed at something, and nothing happen in one day. I mean, it takes like an average of about 10 years between when you start something and you really succeed at it. It takes about 10 years. So you must start somewhere and then put an effort, go through it. Failure is just part of it. I mean, if you count your own failures then for, I mean, the day. But for really imagine, say, maybe I start dating today, next month I suppose you'll do like a hammer, like, the illusion, that way most people, they find themselves inside. And I get friends, they even look like people like DJ Carl. I know how his story start from way back then. Then things start really get better over time and then really fast. You understand now? So if people get that attitude for look at their tomorrow, it will really help a lot for them for succeed. And a really big philosophy where I hold them for go through, for persevere, for be determined and for understand. Say nothing no be impossible, not at all.
Okay. All right. So Dr. Vanes, thank you plenty for the time we don't spend now. And one last question. So first, I ask you, say whether you don't married or whether or you did married or. Why you holla Jesus?
It's gonna part of the interview.
It's gonna part of the interview. Why you not answer that question? You know, when tell me say get in a chatting for hospital, me I don't believe because I know Cameroonian get them. I know my sisters. No. I know when they see fine doctor how they need to be. This will tire me. Okay. All right, thank you plenty for the time we don't spend our week. And we hope say we will actually, host again for Beta Torpoh because again play it in a way we will really like Cameroon continue for the teach way. Yeah, so thank you plenty and see you next time.
It's a pleasure.